Hi, this is Larry Bauer, Chief Executive Officer of the Family Medicine Education Consortium, and I'm talking today with a couple of family physician leaders. Dr. Scott Kennard is a family physician who loves working with doctors. He's in Dallas, Texas. He works with corporations. In fact, right now he's medical director for 25 companies that are using his services during this pandemic crisis. Also with us is Dr. Kara Farley, who's a family physician in the Dallas, Texas area, and she's developed a resource that she would like to make available broadly to help family physicians and others to save lives. Scott, I'm going to turn to you to lead the discussion.
Well, thank you so much. It's exciting to be here today and to share with physicians all over the country, really all over the world, this possibility for them to be an active, vital resource for their patients, the corporations, and the people that they serve by sharing with them what Kara has developed, which is very, very exciting. So, Kara, we'd love to learn a little bit more about your background and how you came to develop something that you'd like to share with other direct primary care and other physicians.
Yeah, absolutely. Thank you for the introduction. So I own a small DPC practice. I just started a couple months ago in the Dallas-Fort Worth area. Prior to that, I was a military physician. And I was a flight surgeon during my last tour. And the end of my tour began with the COVID-19 pandemic in March. And when that occurred, I became part of the lead on our base during the public health emergency to try and help our military members be able to maintain their mission, come to work, make sure that our jets can deliver supplies, but also be aware of the COVID-19 issue and make sure that we're not spreading it and causing undue cases on our base because of that need to be at work. So when I was struggling with those challenges on our base, I realized that what we really needed was a daily screening tool for our sailors and soldiers to use every day before they got to work to check if they had symptoms. And then on top of that, if they did come up with symptoms, a way for them to contact a healthcare professional to see if this actually was something that they needed to be tested for or if it was something else. So within that, and that's where my passion lied in helping our community on our base be able to maintain their mission and go to work every day, I decided to develop an app. So that's exactly what our app does. It allows employees to screen themselves every morning before they come into work for COVID symptoms. It allows the managers to have a different option to see their employees' screenings and see if their employees didn't take their screenings, which gives them the ability to better manage their office as a whole and know if they have someone who has a potential for symptoms.
I think it's so important. You know, one of the things that came out last weekend actually was a study that revealed that 44% of people get COVID from a person who has not yet developed symptoms. So waiting, and we know that, so a person gets infected with COVID, and then there's the first 48 hours, they're just, the COVID's growing in their body. They don't infect other people, and they have no clue that they're infected themselves. Then there's day 3 and 4 where they're infecting their friends, family, coworkers, fellow soldiers in this case, and they have no idea. And then in the 5th day, they develop symptoms, and between 5.5 to 6 days, they get a fever. So how silly is it that we're checking people's fever to keep them from coming to work, thinking that we're going to prevent the spread of COVID? It doesn't make a darn bit of sense.
Yeah, I agree completely. And that was our main issue, was that was our screening tool, was a temperature check at the front door. And then 24 hours later, I get a phone call saying, hey, Dr. Farley, we've got an outbreak here on our plane. So-and-so had his temperature check and it was normal, but he actually had a little bit of a fatigue and a nasal congestion, and that slipped by. So that's why I created this.
Yep. And it seems to me as though there are really 2 major things you're doing. One is you're asking, have you been exposed to anybody else? And
Correct.
if they have, they need to get into the contact tracing. They need to get into quarantine. They need to get tested. One of the big mistakes I see is people get tested in that first 48-hour window where the test is going to be negative, even though they're infected. But you're catching them in terms of they've been exposed. and then you're catching them at the first onset of symptoms. You're not waiting for a fever to go up, and having their human resources team have an option about what they do in terms of containing or preventing spread before they even get in a car to drive to work.
Correct, absolutely. And we're using the app locally in North Texas for companies here where I'm located at.
Yeah, so you have companies that have signed up with you
Mm-hmm.
that pay you an amount to be their medical director and to monitor and survey what's going on in their population to help them do the risk management. And then if somebody comes up with symptoms, you're there as the medical director to offer them support. And what a beautiful thing, if they need to see a primary care doctor, they can just get on the app and reach out to you, and you can do a video medicine visit and take care of them. Is that what I understand you're saying?
That's correct.
Well, what a great model for direct primary care. Larry and I like to call it advanced prepaid primary care practitioners across the United States. So your technology provides the ability to do that. Why don't we jump on to a PowerPoint or a demonstration and have you let the people on the call actually look at your app and see how it works.
Yeah, absolutely.
We can see that clearly now.
Awesome. Okay, so so this is basically our app. So it is a daily screening app for COVID-19 symptoms. Okay, so I use it in the local area here in North Texas, but I realized that this is something that really the whole country could use, and me just being one physician in my small practice limits the ability for it to be all over and in every business and every company where, you know, customers interact, employees interact with each other. So that's why I'm looking at it now for other practices as well. So you would be able to use your own version of the app for your employer groups, your companies, your patients. And this is basically everything that the app offers. So our daily screening, the history within the app, the ability to request appointments with the practice who has the app, and then a manager dashboard where the managers can see their employees' screenings. They can see if they passed or failed, if they didn't screen in the past 24 hours, and then they don't have to even open their phone to know that they had one of their employees screen positive, because it does do a push notification that says, hey, John took a screening this morning and he didn't pass. And then the app can be personalized for your practice. So your own logo, your description, links to your own website. And then it does also offer multiple languages, especially here in North Texas. We have a lot of Spanish speaking individuals, so we do have Spanish as well. And then it's constantly updated. So as we know, in the beginning, the CDC was adding a lot of symptoms. So we add symptoms, we can update it based on anything that's going on. Now, as far as pricing goes, it is custom pricing. And then
that depends on the size of the company, the size of your practice, whether it's one practitioner, multiple practitioners, how much customization is going to go on. I mean, sounds like there's a real need for a conversation between you and the healthcare system or the practice, the doctor, provider, company, to really determine what the right pricing is.
Absolutely. And here's some pictures here of what it looks like on your phone. So you can download it from the Apple iStore, Google Play Store right now. And this is obviously tailored to my practice. So here's your daily screening tools on here. And this is exactly from the CDC website. You have your contact questions, and then you have your symptoms. And then this is showing that staff version. So individuals also have their own history recorded. But then the staff manager option here allows them to see all of their employees' screenings as well. So basically, what does this do for your practice or your insurance company? It's a customized app for you. We also provide all the marketing material you would need to show it to your employer groups. And then we also provide kind of a business in a box, so this complete package, so it's easily implemented. You don't have to worry about learning how to use a whole nother system. And it really is a very simple app in the way it works. We designed it easy to use for employees, easy to use for employers.
Kara, I see this as being so smart because we need to meet companies where they are. And you know, when you walk into a company, say, "I want to be your direct primary care physician, and I want you to sign up with my practice, et cetera, et cetera." Companies are like, "Are you kidding? We were HR, we had a full-time job. Now we got COVID. We got a second full-time job, and you want me to consider a new concept I've never heard of or never thought of? Go talk to my broker." And you call the broker up, and the broker's like, "Oh, it's renewal time. There's no way I can meet you until February, right?" And
Right.
so you get the great big Heisman from them also. So this is really exciting because you're able to meet the company where they are right now and provide them a level of support and service that they can't get from easily from other resources. You're combining the medical doctor that you are, and you're combining the population health proactive, uh, service provider that you have that we all in direct primary care want to be for our patients. We don't want to just be transactional. We want to have the relationship. We want to be with that person over time.
Absolutely.
So, Kara, how would people communicate with you? How would they contact you? And if they want to learn more, what's the best way for them to get a hold of you?
Yeah, so you can go on our website. It's blueoceanhealthservices.com. We have our contact information in there. You can also send me an email directly at Dr. Dr. Farley, Farley, at blueoceanhealthservices.com. So either of those things, if you go on our website, you can fill out a request an appointment option, and we'll get back to you on getting this set up for your practice or for your company.
So, Larry, will it be possible for us to put all those links and all that information? Plus, Kara has a really cool video we decided not to try to go through and show you today, but you'll want to click on that video link, and there's a really nice video that explains this even more.
Absolutely. All that information in the link to the video will be in the message that goes out.
Fantastic. Well, Kara, your entrepreneurial spirit, your passion as a primary care doctor, it's so evident in spending time with you today. Thank you for what you're doing to help build the direct primary care movement. Thank you for what you're doing for your patients and corporations in North Texas. And please keep us informed as hopefully dozens of companies and physicians reach out to you and you help support them in helping our country during this very important pandemic.
Absolutely. Thank you. I appreciate that so much.
So I'm going to bring things to closure and say thank you, Scott, and thank you, Kara.